Welcome back to Open Line. We are talking with Dr. David Aronoff from Vanderbilt University Medical Center. He is the director of the Division of Infectious Disease. He is our expert tonight, and he can handle any of your questions. We got a lot of folks lined up, so I want to get right to it. Teresa is on the line. Teresa, what's your question? Teresa, are you with me?
Yes.
Okay, good. Go ahead.
Hello. Hope everyone's fine. Good afternoon. My question is, I've noticed that it's a lot to do with your hands, and would this happen to be a biochemical that has been released? Because there's so many people losing their lives, and it's like it's all about the hands, and we've had so many viruses, but it's never been introduced so much about washing your hands. So it's like, is that possible, and how long has the medical field knew about any type of disease like this?
Okay, well, let's start right there. Dr. Aronoff, can you explain why we have talked so much about our hands and the transmission and washing our hands?
Yeah, a really good question from the viewer. So, you know, the reality is that many viruses that cause what we might consider nuisance common colds, the runny nose, cough, watery eyes, low-grade fever that we get generally in the winter time, absolutely can be spread by getting them on our hands and touching our eyes, nose, and mouth. And you know, we're taught to wash our hands. We should be doing better as a society at washing our hands. And that would help prevent some of the spread of those colds, particularly during the winter months. But because they are not generally fatal, they generally don't cause pneumonia, and generally we get better after just sort of laying low at home and maybe taking some ibuprofen and Sudafed type of medications. There's not a big messaging from public health that goes out about washing our hands. Here we have a situation where we have a virus that is not only really transmissible, like some colds are, and maybe even more, but unfortunately, it causes a range of symptoms, ranging from symptoms that are like the common cold to really bad pneumonia that puts people into the hospital or into the intensive care unit, to causing death in somewhere between 1 and 2 people out of every 100 people that are infected. And so when we see that kind of severity of illness in something that is clearly spreading from person to person, then from a public health standpoint, it's our job as healthcare providers to think of any way possible that we could interrupt that transmission. And it boils down to being apart so that respiratory droplets don't have the opportunity to go from my mouth and nose to your mouth and nose or eyes. And then it's good hand hygiene. Probably distance is more important than hand hygiene. More of the transmission is probably through the air than through surfaces in between. But early during this pandemic, before we were really doing a lot of messaging, I think there were likely a lot of situations where people were coughing into their hands and then shaking people's hands or giving people a kiss on the cheek or hugging. And that kind of physical contact is a great way to transmit not only the common cold, it certainly works for that, but here we have a potentially lethal infection. And so I think that's why you're seeing so much messaging now compared to what we usually see. And I hope that's a helpful answer for you.
I think it is. Let's go to David on the line. David, thank you for your patience tonight. What's your question?
My question is this: have we reached the top of that disease? Is it coming down now, or is it still going on?
Great question. Okay, David, can you help us interpret the numbers of what we see the governor talk about every day, the mayor talk about every day, folks in different states? Where are we with this disease when it comes to the numbers?
Yes, I really appreciate that question, because that is something we're all paying very, very close attention to. So the short answer is we're still diagnosing new cases in Tennessee every day. So this disease is still spreading, and it is still really important for us to do everything we can to slow the spread of this virus down. What we've noticed, which I think is a cause for some optimism here, is that the number of new cases diagnosed in the last 24 hours was significantly less than it had been in the previous few days. I think it was under 200, maybe around 169 or 170 cases in a 24-hour period. Now, some of that could be due to people not coming in for testing, or maybe it's due to some tests that haven't yet been run. But if we make the assumption that there's no barrier to getting tests, that if somebody comes in for a test, their test is getting analyzed, then it's really exciting to see that the number of cases every day might be going down instead of going up. So the bottom line is we're still diagnosing new cases, and that's what we're trying to slow down. But it is a good thing when the number of cases each day is less than the day before. That suggests we're getting the infection under better public health control, and we hope that sticks. We hope that continues to be the situation, but we're vigilant.
Well, let me ask you this question. As an infectious disease expert, is there going to be a magic number? Because I imagine that people are going to be diagnosed with this coronavirus for weeks and weeks to come. Is there a magic number of cases being diagnosed where we can then say, now it's safe to return to life as normal, even though this is still out there?
Yeah, that's a critical question, and it's a critical question for our mayors and governor to decide when to sort of let up on some of these restrictions around social distancing. There's a lot that we don't know, and we're going to have to learn from cities that were frankly out in front of us in terms of experiencing this virus. So we think of cities like New York or Chicago, Detroit, Atlanta, Birmingham. They are ahead of us in terms of where they are in experiencing this pandemic. And we're going to be able to watch some of these other jurisdictions make decisions based on the activity in their area, letting up restrictions, seeing if they do it too soon, there might be a second wave of new infections. If they do it at just the right time, nothing new will happen, and we'll get a better feel for what's the density of cases every day or in a population. How low does it need to be before we're comfortable letting up our guard? We also are at a bit of a disadvantage because we still don't know how many people have been infected who never got any symptoms at all. So, for example, I have not gotten sick during this time. Have I been infected? Well, I don't really know. I haven't done an antibody test to tell, but those will be available at some point. And that might factor in. If we go into a population of people where it's clear that lots of people are immune and there are very few cases being recorded, you know what? Maybe now's the time to definitely let up on some of these social restrictions. So we're all chomping at the bit to get back out in public, to get our businesses going again. That's going to be a wonderful time. Right now, we're still in that period of time where we have to be social distancing and have to be sheltering at home and watching these numbers to make the kind of decisions that you just laid out. And it's going to be really interesting to see how our neighboring states who experienced this pandemic before we did, how things play out in those, and we'll have to watch them closely.
Okay, we have to take a quick commercial break. More of your questions as soon as we come back.